Here are 10 tips for managing your mental health during COVID-19. Firstly, acknowledge that what's going on is real and that so are your feelings about it. Try to name the main feelings you're experiencing, such as worry or anxiety, and give them a rating from 0 to 10. This can help you keep an eye on how high they're getting. Think of it as a traffic light system. If your level of worry is 0 to 3, then you're probably feeling fine and you can carry on doing the things that you usually do. If your level of worry is about 4 to 6, you might need to slow down and think about doing some things to look after yourself. If your level of worry happens to be 7 to 10, you might need to actually take a moment and use some of the self-care strategies that I'll discuss in a minute. When it comes to finding effective ways of coping, I'll let you in on a secret. There is no magic answer. Different things work for different people, so what works for you may not be the same as what works for your partner, your children, your friends, or other people. Try to focus on what works for you and don't impose your views on others, or be upset if they don't want to do the same things that work for you. One of the easiest ways to start developing a menu of self-care strategies is to think about a difficult time in the past and what helped you get through. For some people, this may have been by keeping busy. For other people, it may have been by talking with friends or a therapist. For others, it could have been by engaging in regular exercise. As long as these were healthy, they're fine to use again. On the other hand, if they're potentially damaging, such as drinking excessively or picking fights with others to make yourself feel better, then try to consciously avoid them. If you're not sure of where to start, then here are some ideas of things you can try. Make a list of things over which you have control and those over which you do not. Make plans for dealing with the former and try not to dwell on the latter. Try and create new routines for your day or week. Make sure these include time for work or study, time for relaxation, time for physical activity, and times for spending with family and friends. Write down 3 things each day for which you are grateful. Gratitude is a great way of helping counter some of the negative thoughts that go with difficult moments in our lives. Get some fresh air or think about a physical activity you can do each day. Read a book or watch a movie. Do 3 nice things for others each day. These don't have to be big things, but know that under such difficult circumstances, you are still able to be kind. Try and limit the amount of time you spend on social media or using other media, especially actively searching out stories about COVID-19. Although some information is necessary and can be reassuring, too much or inaccurate information can make us feel more anxious and overwhelmed. I know it can be hard to do, but try only checking Facebook 2 to 3 times tomorrow and see what difference it makes. If you're already managing your mental health using therapy or medication, then please make sure that you continue to use these in the way that has been recommended. A more stressful time like this is not a time to stop such things, even if they only seem to be helping a little. Try out a range of relaxation strategies such as deep breathing, progressive muscle relaxation, meditation, or yoga online. I'll post some links to some good examples on the United Against COVID-19 Facebook page. It's important to give these things a go because you might like some of them and hate other ones, and you need to know the ones that you're likely to keep doing. Alternatively, there are a number of great apps such as Calm and Breathe that you can download onto your phone. Over the next few days, make a commitment to give some of them a try. Remember that rating scale I mentioned at the beginning? You can use it to guide you. If you're already feeling so worried or anxious that it seems too hard to even try any of these things, you might want to consider talking to a mental health professional, and you can contact one through your local hospital or a government helpline. If you live in New Zealand, call 1737 or check out the healthpoint.co.nz website. Don't forget about the range of online therapists and self-help therapies that are available online. I'll post a list of some good examples of the latter on the United Against COVID-19 Facebook page. By looking after yourself and others, and remembering this is temporary, we can all get through the coming months together.